Hi, my name is Jalmar Ordónigo. I go to talk about outcomes of two trials of oxygen saturation target in premature infants. Definition: in two trials conducted in Australia and the United Kingdom, infants born before 28 weeks gestation were randomly assigned to either a lower 85 to 89% or a higher 91 to 95% oxygen saturation range. During enrollment, the oximeters were reserved to correct a calibration algorithm artificial. The premature outcomes was death or disability at a current gestational age of 2 years.
Babies born prematurely usually need to spend time in a neonatal intensive care unit, or NICU. With preemies, it's important to know these facts. Breathing problems happen because their lungs aren't fully developed. Your baby may be given extra oxygen or hooked to a ventilator or something called a CPAP machine. Many preemies also stop breathing occasionally, a condition called apnea, but in the NICU, they're carefully monitored for this. Because preemies have less body fat, your infant will probably be placed in an incubator to help her control her body temperature. There can be feeding difficulties. Until she learns to suck effectively, your baby may be fed through a tube, but the nurses can still give her any breast milk that you pump or freeze it for use in the future. Also, preemies usually take longer to reach milestones like rolling over, and they're more likely to have learning disabilities. Regular checkups will be important so you and your doctor can detect problems early. Early intervention, which can include physical therapy and speech therapy, can make a big difference. Be sure to ask questions as many times as you need to. And remember, with today's medical advances, chances are that your tiny little baby will grow into a healthy, normal kid.
Application in nursing. If infants were in stable condition with breathing and BMI before 10, oximetry was discontinued. If oximetry was resumed before 36 weeks, a study oximetry was used. Maximum supple the study oximeters under Leosi.
Today we're going to talk about neonatal pediatric oxygen therapy. First, start by verifying the order. Consult the written order to determine a document need for the oxygen and the type of administration device desired. Next, maintain asepsis by washing hands and observe universal precautions utilizing gloves according to the clinical facility's policies and procedures. Depending on the type of therapy to be administered, gather flow meters, necessary tubing, and cannula. Next, identify the patient. Properly identify patient by checking ID name, band, and identify self and department. Explain the purpose of the technique and procedure in terms the patient and/or caregiver can understand. Then you attach the oxygen flow meter or blender to the wall gas. You check the entire system to ensure proper function, analyze FiO2, and make any necessary adjustments. Assess patient's breath sounds, pulse rate, respiratory effort, and presence or absence of cyanosis. Then, record all pertinent data in the patient's chart. And that is neonatal pediatric oxygen therapy.
Pros. Infants who were randomly assigned to the ether oxygen saturation target ranks were expected to have a 30 to 14% incidence of the primary outcome. Assuming an incidence of 35%, we calculate that each year were need to enroll 1,200 infants for the study to have 18% power to detect an 80% point absolute difference between the groups at a two-sided 5% level of significance.
In this video, we shall learn about the oxygen therapy by hood and by nasal cannula. Administering oxygen to sick neonates helps to relieve hypoxia, thus improving the oxygen supply to the tissues. Oxygen therapy is indicated in babies with breathing difficulty, with grunting, with central cyanosis, or with shock. It can be administered by nasal cannulae or by oxygen hood. The flow rate of the oxygen depends upon the device used and the degree of respiratory distress, as can be seen in this algorithm. Attach the oxygen tubing to the oxygen cylinder or to the central oxygen supply. Fill the humidifier with distilled water so that the oxygen delivered is humidified and not dry. Set the flow rate. Here, we shall learn about the administration of oxygen by hood. The flow rate is set 3 to 5 liters per minute. Observe if the bubbles are coming out in the humidification chamber. Remember, the flow rate should generally not be less than 2 liters per minute while administering oxygen by hood. Now, position the baby's head in the midline and keep a shoulder roll to keep the neck slightly extended. Keep the clean hood over the baby's head. The opening seen in the front portion of the hood should be kept at the level of the neck of the baby. Assess the improvement in color and the signs of distress after oxygen therapy has been initiated. If available, one should use a pulse oximeter to note the oxygen saturation. Adjust the flow rate so that the saturation is maintained between 90 to 93%. Let us now understand the important points which are to be considered while administering oxygen by nasal cannulae. Fill the humidifier with distilled water so that the oxygen delivered is humidified and not dry. Set the flow rate to 0.5 to 1 liter per minute. Observe if the bubbles are coming out in the humidification chamber. Remember, the flow rate should be adjusted as hyperoxemia can be damaging to the infant. Position the baby in the same way as explained earlier. Use appropriate size nasal prongs depending upon the weight of the baby. These prongs are available in 3 different sizes, separate for the neonate, for a pediatric patient and an adult. Secure the nasal cannula properly to avoid accidental displacement. Assess the improvement in color and the signs of respiratory distress after starting oxygen therapy. Oxygen saturation monitoring should be continuous in an unstable baby. In stable babies, you require monitoring about 12 hourly. In babies who are chronically oxygen dependent, this could be done 4 hourly. This helps to ensure that the infant receives appropriate levels of oxygen. Adjust the flow rate so that the saturation is maintained between 90 to 93%. Always remember, oxygen should be considered as a potentially toxic drug and should not be given any minute longer than it is required for any individual babies. Premature sick babies may develop retinopathy of prematurity following oxygen therapy. Thank you.
Cons: an interim analysis showed increased mortality at a current gestational age of 36 weeks, occurred in 247 of 549 infants, 45% in the lower target group versus 217 of 545 infants, 39.8% in the younger target group. Death of disability in the UK trial occurred in 185 of 366 infants, fighting that 5% in the lower target group versus 164 of 357 infants, 14.9% in the younger target groups.
Parents who are taking home a new preemie wonder, what should I be on the lookout for? What kinds of things might happen, and how should I be aware of what's likely to happen? We always recommend that we get the baby matched up with a great medical follow-up team.
Premature babies are known to be at a higher risk for certain longer-term health complications than full-term babies. Although many preemies develop normally, it's important to be aware of these potential complications so you can get the help you need if you notice them in your child. Hearing impairment is more common in preemies than full-term infants, particularly if the baby was born very early. Your baby's hearing will probably be tested in the NICU before discharge. Seek additional testing if she doesn't turn toward a clap or your voice, or is having problems communicating once you're home. Hearing problems can lead to language or behavioral problems, so they're important to detect and treat as soon as possible. Treatment typically involves hearing aids and language therapy. Vision problems are also a potential complication of prematurity. The most common ones are crossed eyes or some degree of near or far-sightedness, both of which are usually corrected with glasses. Retinopathy of prematurity, or ROP, is a disease that affects premature babies. It's caused by the growth of abnormal blood vessels in the eyes. Cases vary from mild to severe, but blindness is very rare and usually affects only the most premature babies.
Application in Ecuador. The range of premature brains for the general population is estimated at between 6% and 10%, according to that for the Pan American Health Organization. Ecuador is among the 11 countries with the lower rate of preterm birth in the world with 5.1%, but paradoxical. The first causing for infant mortality in the country, according to index data in the short duration of gestational.
On Monday, November 6th at 2 p.m. Eastern Time, Columbia University medical experts from Morgan Stanley Children's Hospital of New York Presbyterian will host a webcast discussion on the use of bubble CPAP therapy for newborns with respiratory distress syndrome. CPAP stands for Continuous Positive Airway Pressure. Bubble CPAP is a low-tech, labor-intensive therapy that is performed to prevent chronic lung disease.
Chronic lung disease is a serious problem. Not only does it prolong hospitalization and make the hospitalization that much more complex, placing the baby at risk for things like nosocomial infections, but chronic lung disease is also associated with poor neurodevelopmental outcomes. So avoiding chronic lung disease is a worthwhile goal.
Just minutes following the birth, pressurized oxygen is delivered through prongs in the baby's nose.
Any infant who's spontaneously breathing, irrespective of his birth weight or his postmenstrual age, he should be given a trial of nasal CPAP.
Bubble CPAP provides breathing assistance for babies as opposed to a machine doing the breathing for them. The Neonatal Intensive Care Unit at Morgan Stanley Children's Hospital of New York Presbyterian is a proven leader in this non-invasive technique and has among the lowest incidence of chronic lung disease in the world.
It's an expertise that one has to develop. And the expertise not only involves doctors, but also involves nurses and respiratory therapists. It's a team effort.
During the webcast, doctors will also discuss the operational functions of the hospital's CPAP system.
We use the oxygen blender to control the oxygen concentration for the gas sources. We immerse the distal tubing into the water to control the CPAP pressure, and we connect this CPAP circuit to the patient with a Hudson nasal prong CPAP.
Anytime during the webcast, viewers can submit questions to the panel via email by clicking the mDirect Access button on their computer screen. You can watch this internet broadcast on Monday, November 6th at 2 p.m. Eastern Time, live from Morgan Stanley Children's Hospital of New York Presbyterian.
Conclusion. Use of an oxygen saturation target range of 85 to 89% versus 91 to 95% resulted in no significantly higher rate of death or disability at 2 years in each trial, but in significantly increasing risks of this combined outcome and of death alone in post-hoc combined analysis. Thank you.
Speaking for the clinicians and the caregivers, we really need this pediatric soft mask. One size does not fit all, especially when it comes to children. My job is to take care of children and make them feel better when they're in need of my care. Knowing that the only solution I have available for non-invasive ventilation is a hard plastic, ill-fitting mask. And that mask can cause pressure ulcers, disfigurement, and discomfort. And that's a terrible situation for a caregiver. I can't emphasize enough how hard it is on us and parents to see an infant or small child in so much discomfort. We love these circadian soft cloth masks, and even though they're made for adults, we've used them off-label for infants and toddlers. The infants are much more comfortable breathing and moving around more easily, and toddlers love it. It comes in different colors and patterns, which is a lot less scary. And often we let them color and decorate it and make it their own, which they love. And you know how creative toddlers can be. So sometimes we role play and we're scuba divers or soldiers, and that makes it a lot less intimidating for the kids and their parents. We just really need the pediatric soft mask. I hope I've inspired you to give generously so that every caregiver and child in their care can finally breathe comfortably